I'm Gail Guayardo. Welcome to Bloom. Amber Freeman will join us later in the show, but for now, we're kicking off today with one thing that never changes with time, which is the need to pick our battles wisely and make the best of what comes our way. So today, we're choosing our hard with purpose. And when it comes to women, our hormones can be a big determining factor of health. Hormonal balance is crucial for our overall health as it helps to regulate energy, mood, fertility, skin, and metabolism. The hormonal landscape can often feel like a roller coaster. What once worked for your body suddenly doesn't. And many symptoms like fatigue, brain fog, acne, mood swings, and weight fluctuations become a regular occurrence. And our next guest says there are 3 things that you can do right now to reset your hormones and choose a more regulated path. Joining me now is double board certified physician and author of the book, The Perimenopause Reset, Dr. Jen Piefleger. Dr. Jen, welcome.
Thank you so much. Super excited to talk about hormones today.
Yeah, and that is the hot topic right now. Yeah. So are you a proponent of hormone replacement therapy?
Yes, I love bioidentical hormone replacement, and done correctly, make sure we're testing it properly and making it individualized for each woman.
Yeah, because I think it's not a one-size-fits-all.
No.
So when you say, let's make sure we're testing,
yes,
let's make sure it's right, what exactly do you mean by that?
Testing is very important, the correct testing too. You can test blood and also saliva levels. And if you're putting the hormone on topically, like a patch or a cream, you want to check its saliva. So not everyone knows that. And I'll get patients that have very high hormone levels, but the estrogen, the estradiol is not showing up in the blood. So we have to just have more knowledge on this. And especially since it's such a hot topic now, we need to make sure women are getting the correct care.
Yeah, and then also, you know, big news for women that the black box warning is now off, and a lot of doctors are saying, thank goodness, because brittle bones, heart disease, there's so much that can benefit by being on hormone replacement therapy.
Absolutely, and that's about balance. We don't want anything to be too high. Low is bad too, but we want that sweet spot, like Goldilocks, you know? We want it to be in that sweet spot. And we want estradiol also with progesterone and testosterone, DHEA. We want them all to be balanced.
Now, what are your thoughts about the pellets?
I'm personally not a fan because you get really high levels and then deep troughs. So we don't want roller coaster when we want hormones. We want it nice and stable. So I like topical application better for estradiol and testosterone, and then oral for progesterone is nice because it helps you fall asleep a little easier.
Yeah, I'm the same way, and I've always been worried that if I put, you know, a pellet in and it's not correctly formulated, then you're stuck with that for what, about 3-4 months.
Yeah, can't get it out. Can't go back in there
and dig it out.
Right.
Yeah, so I do, like you say, the progesterone sublingual, I do the estrogen patch, and then I inject myself, because I don't do well with creams, with just a little bit of testosterone. Talk to me about the benefits of finding this balance, and how often should we be getting rechecked? Because you say that, you know, one switch in the body and you might need to tweak things.
Yeah, especially when cortisol is at play. That can kind of give our hormones a little shake up. So testing about every 3 months I like to do if any prescription changes. After that, usually every 6 months is good, and they're pretty steady, especially postmenopausal women. Perimenopause can be a little different. You want to check more frequently than 3 months if they're having symptoms or a big life shift.
When should somebody start hormone replacement therapy? What's the ideal time, and how long do you stay on it?
Yeah, well, perimenopause, we can start progesterone because that is on a decline. It's like a sledding hill versus estradiol, which is a roller coaster during perimenopause. So I love some progesterone for perimenopausal women to help balance things out like mood, and that's just given during the luteal phase. So this can start as early as age 35. I'm seeing younger and younger women coming to me in perimenopause with those symptoms. Sometimes we can use supplements to augment that progesterone and support it, but usually in their 40s, they just need that replacement. And then menopause is different for every woman. So that depends, and that's the full cessation of your cycle for 12 months. So that average is in the 50s usually.
I'm also glad you mentioned mood, because it's very frustrating to me that so many women have been suffering and their doctors are just writing them a script for Xanax or whatever antidepressant, and that's not what they need. What they need is their hormones to be balanced, because women don't realize how down in the dumps you can feel when your body's off kilter.
Oh yeah, it is just whip out the prescription pad for an antidepressant and birth control. It's literally the recipe that conventional medicine has right now for dealing with these symptoms. Women are gaslit a lot. They come to their doctors in their 30s and 40s and they're like, I'm tired, my mood is shifting, I'm gaining weight. Oh, you're depressed, let's give you an antidepressant. And that's not what they need. It doesn't help them.
So tell me about your book, the Perimenopause Reset.
Yeah, so this book was written because I've seen hundreds and hundreds of women struggling in perimenopause, and this book is for them to find peace, shed weight, and renew their energy. It's a blueprint for it.
It's a game changer when you get the body in balance. I mean, it's hard to describe until you've experienced the before and after yourself. I mean, the brain fog goes away. You did mention cortisol. I wanted to ask you about that. How do we know if we're having issues?
Yeah, the best way to test cortisol is a 4-point saliva cortisol test. And you can get that test from a functional or integrative doctor. And that really gives us good insight on how the body is handling stress and if your cortisol is down in the dumps or maybe too high because you're burning out. So it's a really good indicator, especially for women. I've seen a lot of women have good cortisol, but then a big spike in the afternoon when their kids are coming home from school, they're getting dinner ready, rushing around. So then we give them some supplements to kind of even them out, calm them down, and maybe some adaptogens. And that can be a game changer when it comes to their mood and their sleep.
All right, well, thank you so much. This has been so valuable.
Thank you.
All right, we're going to share Dr. P. Flegler's advice on Bloom Tampa Bay. We'll be back with more Bloom right after this.